Hello, Indy One Jones. I'm here at ESU1 and I'm here to show you our diving capabilities and our recompression chambers. So right behind me, I have a TRCS, also known as a Transportable Recompression Chamber System. It is capable of treating 2 patients and 1 tender. We use it for diving related casualties. So if someone has any decompression sickness or arterial gas embolism, we get them in the chamber, press them down at 60 feet, give them 100% O2, and then we get them back to health and bring them back, and hopefully they can continue on diving down the road. The chamber is 2 chambers separately. Right now we have them mated together. One is called the TRC, which is the Transportable Recompression Chamber, and the other one is the TL, which is known as the Transfer Lock. Transfer Lock is used to transport inside tenders in and out of the TRC so they can help the patients, give them medical equipment, give them food, give them water, anything like that that we can provide for them. So right now, as we have them mated, it gives you a little bit more room to play with inside. So the reasons why we would put somebody in the chamber are for multiple reasons, but the more serious reasons is decompression sickness and arterial gas embolism, also known as AGE. The reason you get a DCS is because of you're down at depth breathing air and you come up a little bit too quick and you blow your decompression tables and you get sick that way. You'll have numbness, you can get pain in your joints, dizzy, nausea, all that stuff that you would have on surface, and we would get you in the chamber. Another serious diving related casualty is known as arterial gas embolism, which is an AGE. And that is a way more serious condition that we would definitely get you to chamber a lot quicker. It can anywhere from dizziness to death when you get one of those. So we get you in the chamber as quickly as possible, get you down to 60 feet, get you 100% O2, and have you lay down, rest, and we'll heal you back to normal health. You also have different positions that help out with recompression sicknesses and recompression chamber operations. You have a supervisor, you have a outside tender, and you have an inside tender. So the supervisor, he's overall control of all diving operations within that chamber. He tells the outside tender how deep they're gonna go, how long you're staying, when the O2 comes on, and he basically has overall control of the whole treatment table that the patient is under. All right, next we're gonna move inside the dive locker where we have our scuba gear and our Mark 16, which is our underwater breathing apparatuses. Now we're in the dive locker. In here, by my side, we have our scuba gear, scuba rig. We have our stretcher, O2, AD, med kit, and our 2 scuba rigs that we use here at ESU. We use this scuba gear to do ATFP diving, so that's anti-force protection diving, where we go check piers out, check barges, anything like that that's gonna touch a Navy vessel, make sure there's no bombs on those or anything that's suspicious on any of those vessels, so they can moor up to the pier or get fuel from a barge or anything like that. So that's our main mission here, is to perform these type of dives and make sure the fleet can go anywhere and pier up anywhere in the world. So as we right here, we have our scuba gear, which consists of a bottle, buoyancy compensator, and a regulator. So the bottle is filled up to 3,000 PSI of air, and the regulator turns that high pressure air to low pressure air so you can breathe off a regulator. Right here is your standby regulator, which you use in case of emergency, and your primary regulator, which you have in your mouth at all times. The BC provides buoyancy inside the water column, so it can help you, stay up and down in the water column. And inside your BC, you usually have weights in here so that it can help you get down in the first place. A question that we always get asked is, how long does these bottles last? It all depends on how much air you have, how deep you are, how heavy you're breathing. But usually we do a calculation every time we dive. If you're diving at 45 feet, we usually do a calculation to see how long your air is gonna last. Right here we have the Mark 16 diving rig. It is used primarily in explosive ordnance disposal units, and it is a semi-closed breathing apparatus, which means that it doesn't emit any bubbles, and it has a low magnetic signature. It also helps the diver go ahead and dispose and disarm any ordnance inside the water without setting it off. So it's very important in any operations we use in disposing any ordnance in the water columns. That's it. Thanks for coming. I hope you enjoyed learning about Navy diving.